Redlining in Columbus. This is environmental health science.
Today in our video, we will talk about what is redlining, how it has taken form in Columbus, Ohio, and how it has impacted the COVID-19 global pandemic.
Redlining is the systemic discriminatory practice that puts certain services out of reach for residents of certain areas based on race and ethnicity. These practices can be seen in the denial of mortgages, insurance, loans, financial services based on location rather than an individual's qualifications and credit. The Federal Housing Association refused mortgages to individuals within African American neighborhoods to increase segregation efforts.
The practice of redlining was carried out by the Federal Housing Authority in order to increase their segregation efforts. Many communities that were redlined were once with predominantly black populations. In 1947, the actions by property owners in the FHA was brought to the Supreme Court, and redlining was deemed unconstitutional. By then, the practice was so common and widespread that the damage was already done. Over time, city, state, and federal funding was sent to the more non-redlined areas, making it harder for redlined communities to develop better infrastructure to improve, like the Columbus community shown. These African American communities were systematically disadvantaged.
As we look at this map showing the Columbus, Ohio and its vicinities, when looking at this map, certain counties and neighborhoods within Columbus are indicated in red, as shown. Some areas directly around campus show that they are redlined, like by the Kroger or even on King Avenue and the surrounding areas of Columbus State. When looking into the demographics of these neighborhoods, they are associated with low socioeconomic status and indicate a lack of certain resources, like grocery stores with healthy food options, updated housing, etc.
In 2020, the Columbus City Council declared racism as a public health crisis. During the COVID-19 pandemic, there have been multiple health disparities between Black and white residents. These specific areas deal with high levels of community vulnerability, which may include dealing with poverty, disability, lack of health insurance, and lack of access to medical care. People who reside in redline areas today are at risk of a shorter life expectancy and poorer health than those who don't reside in these redline areas. They are also at greater risk of having pre-existing conditions, which may increase the risk of morbidity in COVID-19 patients. This is a prime example of structural racism that is built into the structure of American cities.
Now that we have established that living in redline areas can be a major health risk, it is time to look at the ways we can improve conditions in these communities.
One suggestion we pose for improving health outcomes of people who live in redline areas is to build homes for people in these areas to buy instead of making the only available housing rentals. Many people around Columbus pay the same in rent that one would pay for the mortgage of a starter home. This would also get people out of their apartments that allow for easier transmission of diseases like COVID-19. Allowing access to home ownership will increase property values, increase wealth, and improve health outcomes. Our second suggestion for improving the effects of redlining is for cities to invest more money in these communities and improve infrastructure. Projects like these keep communities more sanitary. Better infrastructure leads to healthier citizens. Our last recommendation is that contractors ensure that they are building new developments for people who already live in these communities and not for new people to come in and gentrify it. By gentrifying redline areas, we force these communities who are already at risk of worse health outcomes into areas where conditions are much worse.
In connection to the EHS model, COVID-19 is a natural source and a biological agent that entered redline communities. Living conditions make it significantly easier for the virus to spread, particularly residents being in close proximity to one another due to more apartments and homes that are closer together. When people are closer, it's easier for the virus to spread through the air, which is the pathway, and can be inhaled, which is the exposure. As you can see, redlining still affects African American communities in Columbus today. Especially with COVID-19, we got to see firsthand how the environment around us, more specifically where we live, heavily impacts our health and ability to survive the unexpected. We got to learn more about systemic racism in Columbus and how we can work to reverse its negative health outcomes for people living in redlined areas. This could be through making housing more accessible, investing in better infrastructure, and preventing gentrification by prioritizing the well-being of locals. So environmental health is important to us all because we experience the effects of our environment in noticeable and unnoticeable ways. By paying attention to what impacts our health, or even a community member's health, we can bring awareness to these issues to ultimately play a role in improving the overall well-being of our community.